Nerandomilast mechanism of action. Preferential Phosphodiesterase 4B inhibition in the treatment of pulmonary fibrosis. Interstitial lung disease, or ILD, is an umbrella term for a large group of diseases of the lung tissue that can lead to pulmonary fibrosis. These are distinct from obstructive airway diseases such as asthma or chronic obstructive pulmonary disease. Many ILDs have the potential to become progressively fibrotic. The most common progressive fibrosing ILD is idiopathic pulmonary fibrosis. However, patients with other ILDs may develop a progressive phenotype termed progressive pulmonary fibrosis. In patients living with pulmonary fibrosis, there is complex interplay between immune-mediated and fibrotic mechanisms that contributes to the development and worsening of fibrosis. Pulmonary fibrosis develops as a consequence of an abnormal healing response following injury to the alveolar epithelium or vascular endothelium. Damage to vascular endothelial cells leads to vascular leakage, which results in an inflammatory response. Fibroblasts and inflammatory cells such as macrophages play a role in disease development, resulting in the release of pro-inflammatory and pro-fibrotic mediators. Fibroblasts are recruited into the interstitium and subsequently differentiate into myofibroblasts and secrete extracellular matrix. Chronic overexpression of pro-fibrotic and pro-inflammatory mediators drives a self-sustaining process of inflammation and fibrosis through multiple signaling pathways via fibroblasts, epithelial cells, and immune cells, leading to excessive extracellular matrix deposition, scarring of lung parenchyma, impaired gas exchange through the alveolar capillary interface, and ultimately impairment of pulmonary function. Cyclic adenosine monophosphate, or cyclic AMP, is a key molecule involved in intracellular signaling that plays a role in regulating fibrotic and inflammatory pathways. High levels of cyclic AMP promotes a homeostatic environment with decreased inflammatory cytokine synthesis, increased anti-inflammatory cytokine synthesis, and decreased fibroblast proliferation, myofibroblast differentiation, and extracellular matrix synthesis. Cellular levels of cyclic AMP are regulated by the phosphodiesterase 4, or PDE4 enzymes. Low levels of cyclic AMP drive pro-fibrotic and pro-inflammatory cell signaling. There are 4 families of the PDE4 enzyme: PDE4A, B, C, and D, all of which hydrolyze cyclic AMP. PDE4 enzymes are differentially expressed throughout the body. The PDE4B subtype is highly expressed in lung tissue and the immune system, and is therefore an attractive target for treating pulmonary fibrosis. Previous generations of pan-PDE4 inhibitors have not shown selectivity for PDE4B and are associated with gastrointestinal side effects due to their inhibition of PDE4D. Nerandomilast is a preferential inhibitor of PDE4B with antifibrotic and immunomodulatory properties and reduces vascular permeability. Nerandomilast exhibits a 9-fold preference for PDE4B compared with PDE4D. In immune cells, such as macrophages, inhibition of PDE4B by nerandomilast leads to increased intracellular concentrations of cyclic AMP, which leads to decreased expression of pro-inflammatory cytokines, such as TNF-alpha and IL-2. This has immunomodulatory effects, including decreased immune cell infiltration and activation. In fibroblasts, increased intracellular concentrations of cyclic AMP due to Nerandomilast inhibition of PDE4B leads to reduced production of pro-fibrotic mediators, such as TGF-beta. This leads to antifibrotic effects, including reduced proliferation of fibroblasts and reduced myofibroblast differentiation and extracellular matrix deposition. Preclinical evidence suggests that PDE4B inhibition by nerandomilast enhances endothelial barrier integrity by reducing microvascular permeability and normalizing adhesion molecule expression to strengthen cell-to-cell and tight junctions. Summary points are shown on screen. Thank you for watching.